Have you ever woken up in the middle of the night feeling like you swallowed a handful of cotton balls? It's that unmistakable dryness in your mouth, the kind that sends you reaching for a glass of water on your nightstand. Many older adults shrug this off as nothing more than an inconvenient part of aging, a simple sign of getting older. But what if that persistent thirst is actually your body's subtle alarm bell, hinting at something more serious like chronic dehydration or even undiagnosed diabetes? This isn't about creating fear. It's about shining a light on a commonly overlooked issue among those of us past 65 who want to stay active, independent, and healthy for as long as possible. If you're 65 or older, there's a good chance you've noticed that some things about your body just feel different than they did at 40 or 50. Maybe you don't bounce back from a late night as quickly. Perhaps you can't go as long between water breaks when you're gardening or taking your afternoon walk. These changes can be misleading because, while it's natural for our bodies to adapt as we age, many of us mistakenly attribute every new quirk, like a chronically parched mouth, to just getting older. And that misconception can lead us to ignore signs that warrant attention. Addressing something as simple sounding as a dry mouth really matters for your overall quality of life. Staying properly hydrated improves energy levels, mental clarity, and even muscle and joint comfort. Meanwhile, undiagnosed diabetes or prediabetes can cause a range of complications if left unaddressed. Imagine feeling more vibrant in the mornings and experiencing fewer energy dips during the day. Think about not having to constantly deal with that raspy feeling when you speak for a while, or that annoying sticky sensation on your tongue. Beyond the physical relief, early detection of blood sugar issues can help prevent more serious conditions like nerve damage and kidney problems down the line. That's a genuine quality of life boost that every senior deserves to enjoy. Today, we're going to investigate 4 key points that many seniors overlook when it comes to a chronically dry mouth. We'll explore why thirst signals become less reliable as we age, how a dry mouth might be masking more complex health concerns, which simple lifestyle shifts can make a big difference, and how to work with your healthcare team to rule out or manage diabetes. By the end of our conversation, you'll be armed with practical steps to spot the hidden danger signs of dehydration or diabetes, and you'll know exactly what you can do to take charge of your own well-being. This isn't about gimmicks or miracle cures. It's about listening to your body's quieter signals and responding in a way that supports your overall health. You might be wondering how I've come to share this information. Over the years, I've delved into emerging research on senior wellness, talked with healthcare professionals, and listened to countless stories of older adults who found surprising ways to feel more energetic simply by addressing something small they had overlooked, like dryness in their mouths. I'm not a doctor, and I can't give you direct medical advice, but I can help guide you to the questions and discussions that may brighten your path to better health. Before we dive in, I'd love for you to reflect on a quick question. When was the last time you genuinely felt hydrated and energized throughout the day? If it's been a while, you're in the right place. Let's walk through these insights together and unravel how a parched mouth might be the tip of an iceberg that's worth exploring. Our first step is to challenge the common assumption that a dry mouth is just part of aging. Let's reveal how our thirst signals can mislead us in later life, why we might still need more fluids even when we don't feel thirsty, and how something that sounds so minor can have a major impact on our daily well-being. Many people over 65 believe dehydration is a summer-only concern, something that happens to marathon runners or people who spend all day in the sun. But one of the surprising facts about dehydration is that it can creep up silently. As we age, our bodies become less adept at signaling thirst, making it easier to miss the early stages of fluid loss. You might only realize you're dehydrated once your mouth feels as dry as desert sand. If you've ever brushed this off thinking, "I'm just a bit thirsty, it'll pass," you're not alone. That's the misconception that can lead to recurring cycles of dehydration. Consider Marvin, who is 72, living on his own since his wife passed away. In his younger days, he never thought twice about drinking enough water. He'd get thirsty, he'd grab a drink, and that was that. As time went on, Marvin found that he didn't feel thirsty as often. He noticed occasional headaches, drier skin, and more frequent muscle cramps. Yet he still never connected these issues to dehydration. One day, Marvin found himself so dizzy, He had to sit down and skip his usual evening walk. After speaking to a friend who recently saw a nutritionist, he realized the problem might be linked to his fluid intake. Once he started tracking how much water he actually drank in a day, he discovered it was less than half of the recommended amount for someone his age and activity level. What's important to understand is that many older adults, like Marvin, rely too heavily on their thirst alarm. But that alarm often becomes faulty as we get older. Also, certain medications, like diuretics or those for high blood pressure, may increase fluid loss or interfere with thirst signals. If you've been told to reduce your fluid intake because of a medical condition, this can further complicate the picture. The net effect is that your body might be crying out for water even if you don't feel the urge to drink. The solution starts with a small shift. Make hydration part of your daily routine instead of waiting for thirst to remind you. Some seniors find it helpful to set alarms on their phone or watch to prompt them to drink a glass of water every couple of hours. Others keep a water bottle in a brightly colored or decorated container within arm's reach as a reminder. You can also infuse your water with slices of citrus, cucumber, or berries to make it more appealing. Herbal teas at a mild temperature can also provide hydration with a bit of flavor variety. The physical benefits of better hydration are immediate and long-term. You might notice more energy, less frequent headaches, and smoother digestion. Emotionally, being well hydrated can also enhance your mood, making you feel less irritable or sluggish. And let's be honest, a comfortable mouth that isn't bone dry all day can be a relief on its own. As you start paying more attention to your fluid intake, keep an eye out for changes in your overall health. Notice how your joints feel when you're more hydrated or how your mind feels clearer. And don't forget to share these observations with your healthcare provider if something seems off. They can guide you in balancing hydration with any medical concerns you have. If you're feeling ready to take on this simple but effective change, give yourself a silent pat on the back. You're stepping into the role of a detective, gathering clues, testing your hypotheses, and drawing more accurate conclusions about what your body truly needs. Now that we've established how our aging bodies often misinterpret thirst and how that can contribute to a persistently dry mouth, let's go a step deeper. Sometimes, even if you drink plenty of water, your mouth continues to feel parched. This could be a warning sign that it's not just dehydration at play. Hidden diabetes or fluctuating blood sugar levels might be part of the puzzle. It's easy to believe that you'd know if you were diabetic. After all, don't people with diabetes have dramatic symptoms like constant thirst and frequent trips to the bathroom at night? Yes, these classic symptoms exist, but they're not always obvious. Older adults, in particular, can develop a milder form of type 2 diabetes or prediabetes that flies under the radar for a long time. You might attribute mild fatigue to age or assume that occasional blurry vision is just another sign your eyes are getting older. Meanwhile, the dryness in your mouth persists, hinting that your body is struggling to balance fluid levels because excess glucose in the bloodstream can pull water out of your cells. Look at someone like Doris, age 69, who considered herself relatively healthy. She had the usual aches and pains, but nothing too concerning. She noticed she felt thirsty more often, especially at night, but chalked it up to living in a drier climate. Even so, she started waking up 2 or 3 times a night with a parched throat. Eventually, during a routine checkup, her doctor ran a simple blood test and discovered that Doris was on the borderline of type 2 diabetes. Suddenly, that ongoing dry mouth made more sense. Her body's elevated blood sugar was impacting her hydration levels. If you suspect that diabetes or prediabetes might be a factor, it's essential to speak with a healthcare professional. Don't panic. People live healthy, active lives with well-controlled diabetes. The key is to catch it early, before it leads to complications that can affect your eyes, kidneys, and nerves. You might request a fasting blood glucose test or an A1C test, which shows your average blood sugar levels over several months. Armed with the results, you can discuss strategies ranging from dietary changes to medication management, depending on your individual situation. One of the best detective tools for dealing with borderline or established diabetes is mindful eating. Focus on reducing added sugars, simple carbohydrates, and highly processed foods. Instead, emphasize whole grains, lean proteins, healthy fats like avocados or olive oil, and plenty of vegetables. This can stabilize blood sugar levels and in turn may relieve some of that dryness you feel. Consider the impact of sweetened beverages too. Even fruit juices, which seem healthy, can cause sudden spikes in blood sugar. Switching to water or unsweetened drinks not only helps your hydration, but also prevents undue stress on your system. When you manage your blood sugar effectively, you'll notice physical improvements like steadier energy, fewer sugar cravings, and yes, often reduced mouth dryness. You may feel calmer emotionally too, because erratic blood sugar can cause mood swings or feelings of irritability. Being proactive in this area can help you maintain independence, keep your vision clearer, and stay active in activities you love, whether that's playing with grandchildren or going on daily walks with friends. So if you've tried drinking more water, but your mouth still feels like you swallowed a handful of dust, consider the possibility of hidden diabetes. Testing for elevated blood sugar levels and making appropriate lifestyle modifications might be the clue you need. And remember, a diagnosis is not a life sentence of discomfort. It's a starting point for targeted changes that can help you feel much better overall. Keep a close watch on these signals, and if you're noticing any correlation between what you eat or how your mouth feels afterward, bring this up at your next doctor's appointment. At this point, you may be wondering, I've increased my water intake, I've looked into my blood sugar, but why do I still feel so dry? This is where medications, mouth breathing, and other environmental factors can come into play. Often, seniors attribute dryness solely to not drinking enough or potential diabetes, but multiple smaller causes can join forces to create that uncomfortably dry mouth. Many seniors take more than one prescription. It's not unusual to have something for blood pressure, maybe another for cholesterol, and perhaps an over-the-counter pain reliever or allergy medication. A lot of these medications can interfere with saliva production. Some antidepressants or antihistamines, for example, are well known for causing dryness in the mouth. The tricky part is that you might have been on these medications for a long time, and over the years the side effects pile up, intensifying the dryness without you linking it to any particular pill. Let's consider Terrence, 74, who has high blood pressure and seasonal allergies. He's been on medication for both since his mid-60s. Over time, Terrence started noticing that he had trouble swallowing certain foods unless he took a sip of water. He also found it increasingly difficult to speak for extended periods without coughing or feeling his throat close up. Initially, Terrence thought it was just another quirk of aging, but after discussing his symptoms with his pharmacist, he realized that some of his medication dosages could be adjusted or taken at different times of day to reduce dryness. Terrence also discovered that using a humidifier in his bedroom helped minimize nighttime mouth breathing, improving his overall comfort. If you suspect your medications might be contributing to dryness, talk to your pharmacist or doctor. Ask whether there's a lower dose you can safely try or an alternative medication that doesn't cause as much dryness. Even the timing of your medication doses can make a difference. Don't forget that over-the-counter medications, especially cold or allergy meds, might also play a role. Environmental factors are another piece of the puzzle. Dry air in your home, especially in the winter, can leave your mouth and nose feeling parched. Adding a humidifier, as Terrence did, or even placing a bowl of water near a heating source can boost moisture in the air. If you've noticed you wake with a dry mouth, it might be because you breathe through your mouth at night. This can be related to sinus issues or simply a habit. Sometimes practicing nasal breathing exercises or using special strips to keep your nasal passages open can make a world of difference. The emotional benefits of addressing these smaller contributors to mouth dryness are often overlooked. There's a sense of relief that comes from not having to constantly sip water just to speak comfortably at family gatherings or social events. It's also empowering to realize that you can often mitigate side effects by being proactive, talking openly with healthcare providers, making slight adjustments to your environment, and trying new approaches to old problems. A good rule of thumb is to keep a log of what you've changed in your daily routine, whether that's altering your medication schedule, adding a humidifier, or practicing nasal breathing, and note any improvements or setbacks. This kind of record keeping is invaluable when you talk to a doctor or pharmacist. They can see patterns that might otherwise go unnoticed and help fine-tune your approach. Take a moment right now to think. Have you noticed your dryness worsen at a certain time of day or after taking a specific medication? Jot it down. You might be surprised by the patterns you discover when you play the role of a health detective in your own life. Now that we've examined how dehydration, possible diabetes, and medication side effects can each contribute to that persistent dryness in your mouth, you might be thinking, okay, what's my next move? There are practical, day-to-day steps you can take to create a more comfortable mouth and support your health as a whole. And the good news is these steps don't require any extreme overhaul, just a series of small, consistent actions. First, establish a baseline. Keep a simple journal for a week, noting every time you feel dryness in your mouth. Write down what you were doing, the time of day, and anything you ate or drank around that time. This helps you see if there's a particular pattern. Maybe your dryness is worse late in the evening or after a certain type of meal. Second, work on strengthening your hydration habits. If you already tried increasing water intake, see if you can add foods with higher water content, such as cucumbers, watermelon, or soups with low sodium broth. These foods not only hydrate, but can also provide vitamins and minerals that support overall health. Keep a water bottle by your side and consider adding a splash of fruit juice if plain water feels dull. The key is to make drinking fluids convenient and enjoyable. Third, address your nutrition in a balanced way, especially if blood sugar issues are on your radar. Focus on whole foods, vegetables, lean proteins, healthy fats, and whole grains. Each meal should ideally contain fiber and protein to slow down how quickly carbohydrates hit your bloodstream. This can help keep your blood sugar more stable throughout the day. If you feel uncertain about what to eat, a brief consultation with a nutritionist or a class offered by a local senior center can give you tailored advice. Fourth, create a medication check routine. Once every few months, schedule a time to go over all of your medications, prescription and over-the-counter, with your pharmacist or healthcare provider. Ask if there are any known side effects that have been newly discovered, or if new medications on the market might offer similar benefits with fewer drawbacks. If you're on a multi-drug regimen, this step can be enlightening and may reduce your overall medication load. Finally, remember the power of gentle exercise. This might not sound directly related to mouth dryness at first, but movement plays a big role in blood sugar regulation and circulation. If you can manage it, try short walks after your main meals. This helps your muscles use the glucose in your blood more effectively, potentially reducing the stress on your body that contributes to dryness. Plus, staying active often encourages you to hydrate more consistently. The physical benefits of these steps can be substantial: clearer thinking, fewer bouts of exhaustion, and even improvements in how your skin and hair feel. Emotionally, taking charge of your health can boost your confidence and sense of independence. There's a special kind of satisfaction in knowing you're being proactive rather than reactive, especially if a dry mouth is your body's way of nudging you toward healthier habits overall. If you've made it this far, you've picked up on some powerful detective tools to keep hidden dehydration and diabetes at bay. You're noticing your body's clues, investigating possible causes, and experimenting with solutions that fit your life. But information alone doesn't bring change. Action does. So ask yourself, what one small step can I take today to feel less dried out and more invigorated? It might be as simple as filling a reusable water bottle right now and setting an alarm to drink from it every couple of hours. Or maybe it's reaching out to your healthcare provider to ask about a blood sugar test you haven't done in years. You don't have to fix everything at once. Small steps add up to significant improvements over time. And along the way, don't forget to celebrate little wins, like sleeping through the night without waking up desperate for water or feeling more energized on your morning walk. These are the moments that add up to a better, healthier quality of life. As we wrap up, take a moment to imagine your life with a comfortable mouth, stable energy, and a clear sense of direction regarding your health. Picture confidently running errands or chatting with friends without that nagging dryness or the worry that something unseen might be wrong. It's not about making drastic changes overnight. It's about noticing the signals your body sends you and responding in a thoughtful, consistent way. If any of these insights resonated with you, consider sharing this video with a friend or family member who might also be experiencing persistent dryness but hasn't given it much thought. Sometimes hearing someone else's story can spark a realization that leads them to take action. If you're ready to dive deeper, you might schedule that conversation with your doctor or a registered dietitian for more personalized guidance. And if you found this information helpful, you can stay connected with future tips and strategies by subscribing or following, so you never miss a chance to learn more about living well as you age. Most importantly, remember that you are your own best advocate and detective. A dry mouth isn't just a trivial complaint. It can be a telling clue about how your body's functioning and what it needs. By paying closer attention and making small, consistent adjustments, you can transform that frustrating dryness into an opportunity to catch hidden dehydration, rule out diabetes concerns, and ultimately experience the vitality and comfort you deserve. You have the wisdom of experience on your side. Combine it with these practical steps, and you'll be taking a powerful stand for your own health and independence.